Welcome to the Lehigh Valley Aging in Place Virtual Education Seminar. My name is Kim Garrison. I'm from Heather Glen Senior Living, and I'm the Education Chair for Lehigh Valley Aging in Place, and I want to thank you all for taking the time to join us this evening. Our nonprofit organization is made up of professionals from the private, the public, nonprofit, and business sectors who are committed to helping seniors. Comprehensive senior resource guide can be found on our website, and we encourage you to utilize it in the future for any services that you may need. Tonight, 5 of our outstanding members have agreed to be part of our care panel. Our theme tonight is What's Next? A roadmap to being proactive instead of reactive. Each of our care panels will do a brief introduction, and then we will begin our discussion. If you have any questions, please feel free to type them in the chat, which will be monitored by Leanne. Thank you, Leanne. We also encourage that if you would like to a personal invitation to our next education seminar, to take a moment to put your email address as well in the chat. And that's where you'll also find the contact information for all of our speakers. So let's begin. Our first introduction will be by BHHS Fox and Roach Realtors. Shirley?
Hi, thank you very much. Just to introduce myself a little bit, I do work with Berkshire Hathaway Home Services, Fox and Roach. We do cover the entire Lehigh Valley, and I've got 38 years of service experience. I've built a small team here in the Lehigh Valley, and I have my seniors real estate designation. So I've obtained the designation so that I could have a better understanding of how to take care of our seniors and the many challenges that they encounter when they're going through various phases of moving out of their homes that some of them have been in many, many years. So thank you very much. And I look forward to answering some questions.
Awesome. Thanks, Shirley. Next will be Falk Funeral Homes. Donna?
Good evening. Hi, Kim. Thank you so much for inviting me to join you tonight. My name is Donna Falk. I am both a funeral director and social worker, and I am a co-owner of the Falk Funeral Homes and Crematory. We are in Hellertown in Pennsburg, and my primary focus is to help families through a very difficult time throughout the entire process, and then also afterwards to bridge them to services that they may need to move on with their lives. So I'm very happy to be here, and I look forward also to answering any questions people may have.
Awesome. Thank you, Donna. Next, Caring Transitions of the Lehigh Valley. Brian?
Hi, Kim. Thank you. And at Caring Transitions, we help seniors when they're relocating into senior communities. We do everything from come in and help you organize, plan. We can do a floor plan to help you place your items neatly in your new home. We'll pack you up, we'll move you and resettle you once we get you there. We also offer services to go back to your former house. We have an online auction to sell your valuables. We donate items that are unsellable and get rid of the rest. So we do soup to nuts and take care of your needs during a difficult transition time. And we try to make it as joyful as possible to make sure that everybody is comfortable and stress-free. And again, I look forward to answering any questions you may be having.
Thank you. Next is Compassionate Care Hospice. Jess?
Hi, everyone. My name is Jessica Adam. I'm a liaison with Compassionate Care Hospice, which is a part of a much larger company called Amedisys. Our care center is based in Bethlehem and covers Lehigh, Northampton, Carbon, and Schuylkill counties. So as I did mention, being a part of a much larger company, Amedisys, we are actually able to help families all throughout the United States, which is pretty cool. Just a little piece of hospice trivia. Hospice actually comes from the root word hospitality. So the idea of hospice actually came back from medieval times, and it was like a shelter for sick travelers along the way. So hospice has come a long, long way since then, and it's pretty cool. It offers a solution really to help maintain a quality of life, dignity, and self-direction for patients and caregivers. So it actually takes about 3 to 5 mentions of the word hospice for people to really get a true understanding of what it is. So I hope tonight we can provide some clarification about what hospice really is. Sometimes people think it speeds up the death and dying process, and it instead helps patients really live the remainder of their lives. So we hope to clarify those things, and we'll discuss the physical, emotional, and spiritual support that it can really bring to you and your families and loved ones.
Thanks, Jess. Next, Navita Health Advocates, Kathy.
Hi, thank you, Kim. So happy to be here. Thanks for asking me to participate. My name is Kathy Abreu. I'm a registered nurse and board certified patient advocate and health educator. And basically, I bring my clients and their families peace of mind by helping them navigate today's crazy healthcare system. I help people communicate with their doctors by attending appointments with them. I make sure that all their questions are answered and in terms that they understand. I help people during periods of transition, maybe coming home from the hospital, getting services set up, equipment installed in the home. I help people help them determine when it may be time to transition into a personal care or skilled care community. Most often the calls I get are from people who live out of the area are calling me for help with somebody who lives in the Lehigh Valley. So that's a common call I get, but I welcome any questions anybody's got about health and well-being. Happy to be here.
Awesome. Thank you so much. So I just want to remind everybody, if you aren't speaking, if you can mute, that way it'll keep the noise level down so we can each hear the responses. So I'm going to start with Shirley. So the first question we had was, how does a senior decide to sell or age in place?
Thank you, Kim. So the very important thing for our seniors to think about is their quality of life. So that's first and foremost. And everybody is at a different stage when they start to think about maybe selling the house. But if you are not enjoying the things that you used to do, like gardening or caring for the home in general, if those things are really starting to get difficult for you, it might be time to consider selling the house. And there's a lot of other things too, if you're not able to drive anymore, or if you need medical care, there's so many things. But the number one thing that I say when I sit down with people that I don't maybe intimately know yet is, what is your quality of life? And what do you picture yourself? How do you want to be living your life in the third chapter or in your, winter season? So that's kind of how I go at it.
I would imagine too that children of the people that are making the decision to move should have some input on that, because I know we find that a lot of times the senior may not be able to do that, but then it falls on the family members that are providing those things to you, right, Shirley?
Yeah, absolutely. And a lot of times I will say that when we're meeting, very often, in fact, most often, the caregivers, family members, whoever else is going to have some input and who have a lot of care around what's happening will be present for those meetings, for those initial meetings. So to your point, absolutely.
Okay, awesome. Next, Kathy, what is exactly care management?
Well, it's a very broad term, but to point out a few major things. Like I said, I very often get called by relatives who live out of the area, and they're concerned about loved ones that they don't get to see all the time. And they're concerned maybe mom and dad have been falling. They're not sure if they're going to their doctor's appointments, taking their medications. And so a lot of times people have family members to help with all of that, schedule the appointments, provide transportation and all of that. And so when people do not have that kind of support locally, they or the family call me for help with those things. Another type of call I commonly get is from somebody who is a primary caregiver of a loved one and is the only one in the area, has no backup. So I'm going tomorrow to see a couple. What happens if something happens to me? Who's going to take care of my husband? And so I step in as a wingman to be that person, so that maybe the primary caregiver can go to New York City to see a show for an afternoon without a worry, or go away for a weekend to a family wedding. They can't take their loved one anymore, and they don't have anybody to kind of give them that support. So it's a very broad umbrella, and I do a lot of those hands-on types of things.
Thank you. Donna, I saw you kind of smile there, because that probably hits home for you, right? Like when people need that support when something does happen to the loved one and what to do. So can you share a little bit, maybe what if, how can you be proactive, like pre-planning your funeral so it's not maybe overwhelming if something does happen to a loved one?
Well, I think it's important for people to discuss, not only with their spouses, but also with their children, what it is that they would like to see happen when they should no longer be here. Because one of the worst things is when children, when a parent dies or a spouse dies and there's been no discussion. So then there's all of the questions about, do they prefer burial? Do they prefer cremation? Will I be going against their wishes? I don't know what their wishes are. Did they want to be buried in a family cemetery, a new cemetery? There's all of these questions that even if you just have a very simple conversation about, hey, let's just talk about this a minute. What are your thoughts about cremation? What are your thoughts about a memorial service? Do you want to have that? What about in the newspaper? Just to even have that conversation, even better would be to write it down and to share it with your loved ones, to put it into some safe spot where they know where it is, so that people are not so much in the dark. Because when you lose someone, it's already such a difficult time. And then to have to deal with all of the little questions about, oh, I don't want to do the wrong thing. It's important to plan ahead.
When someone's pre-planning, does that mean that you have to prepay?
Well, actually, it doesn't. Many times, if someone is looking at going into a nursing facility or have been in a nursing facility and have spent down their monies, it's important that someone prepay, because the nursing facilities want to be sure that you have the resources to take care of your own funeral, because of course they're not paying for it. So in those instances, it's important that a funeral is prepaid. But for the most part, the most important thing is to have a plan to let people know what it is that you want to do. And certainly if people are looking at prepaying, you want to be sure that when you do so, it would be to protect assets from a nursing home or from, to be sure that they're there and that your family is not having to pay for those things afterwards.
What's the question you've heard, Donna, from a nursing home that's perhaps called you and no family has decided?
I'm sorry, say that again.
Can you describe a situation where a nursing home has called you and they've had a death in their community? How is that handled when there's no pre-planning?
Well, that's very interesting. Oftentimes the social services person at the nursing facility will call us ahead of time to alert us that, this person doesn't have family. This person needs to do something about their funds before they run out. So oftentimes I've gone to nursing homes to actually sit down with a patient and ask them, what is it that you want to do? That's certainly possible to do. Or we discuss with the staff, like, who are their friends, are their family?
I would definitely think,
reach out to us?
Yeah, I would definitely think if they were on hospice services, Jess, maybe you can talk to this, like some of the support that's in place when someone's on hospice in their home or even in a community, I guess, no matter what, because it's the same service no matter where you are, correct?
Right, right. So absolutely, yes. We have a full team that's ready to help. And Donna, we have a social worker right upon meeting the patient and family. They do their initial assessment. It's one of the first things we ask. Do you have arrangements in place? And if not, it's a tough conversation for patients and families. And a lot of times we do come across that it's not been discussed. So it is something our social workers delve into. They're just one part of our amazing team. We have volunteer coordinators, we have chaplains, we have volunteer coordinators who are doing beautiful ceremonies right now in facilities for our patients that are on our services. Our team also consists of our amazing nurses who do such a fantastic job with our nurse aides as well. So it's really an amazing team that we have that is covered by the hospice benefit, which is something that people don't realize, that all of these wonderful services we provide are 100% covered by Medicare and the Medicare Medicaid benefit. So it's such an underutilized Medicare benefit that we're really trying to educate everybody a little bit more about what is available to them as a Medicare covered benefit. And as well, most private insurances do offer a hospice benefit in addition to that. So, but yes, we do try and pre-plan, Donna. And I think we've reached out to you a couple times, your company.
Yes, and the hospice programs are wonderful about doing that. And there's such a great resource for families for so many reasons, but definitely to start that conversation at that point is just wonderful.
And I imagine, Brian, when you have families that reach out to you when someone has passed away, like, tell us how you can assist families, because I would imagine daunting task that's ahead of them when they've got a home to clean out that their loved ones have lived in for like 50 years. So how is Caring Transitions here to help with that?
Well, what we can do in that situation is we come in and we can prepare the house for whatever the next step is. We work directly with the realtor because obviously the house is going up for sale, or usually the house goes up for sale. So we work with the realtor to help stage and put things where it's needed to have the proper staging. We have an online auction, or we can do an estate sale. So we'll sell the valuable items that the family has left. If certain items need to go to family members, we can deliver them. Maybe a buffet or a secretary's desk needs to go to the son or daughter, we'll do that. We work with a lot of local charities to help get the items that are not sellable but still have life left to charities that find their way to the field. We work with charity. We have local charities that we work with, but if the families have specific charities they'd like the items to go to, we work with them. And then finally, we just clean out the rest. We just remove all the remaining pieces. The team comes in, we can do a light cleaning, or we don't usually do the heavier cleaning, but we can do a light cleaning if the house is in great shape and leave it ready to go for the next family. So we can kind of handle everything for them.
So I imagine once they clean out, then that's when they're going to need Shirley. So Shirley, like, with the market now, how is that going? Because I know it's been kind of crazy with COVID, and give us a little bit of an update on how things in the housing market are out right now.
It's really interesting because the thing that we say to our clients and potential clients is really always the same thing. And I'm going to tie it into what's happening right now. But people will always say or ask us throughout the year, regardless of their age, whatever their circumstances, Shirley, is now the best time for us to make the move? Like, when's the best time? And we always say, and we mean this sincerely, it's not just a shtick, the best time for you to move is now. If you're really thinking about making a move, the best time for you to move is now, because it just fluctuates. We have these ebbs and flows, and it just is what it is. For our seniors, the greatest thing for everybody, the greatest thing that's happening right now is that homes are selling for the highest possible prices. They are being appraised quite high and for very little work. Now, that doesn't mean, you know, all due respect to some people, and I have some of these homes where the homes are very challenging to sell. They've got, you know, 40 years into the house, and that equates to 40 years of stuff. And we're hoping that we get Brian in there. But very often, honestly, it's the real estate agent that sometimes is being called first. We go there and we're supposed to give them a price, right? Or kind of start the ball rolling for them. And that is exactly, you know, the issue right now with this fast moving market. You don't have to do a whole lot. We still have to be reasonable as sellers. And, you know, even if you're doing a bridge loan, which is a lot of times what we're doing for our seniors, we're recommending that they get these bridge loans. You know, they're getting 80% of the equity in their home. And what the banks are doing is they're calling us and saying, hey, listen, what are you going to be selling the house for? And then we, you know, provide the comps and we tell them that they're going to get $100,000 more than what they ever thought. Okay, I'm just kidding. But it is going to be a lot higher because of this fast moving market. And so it is a really good time to sell. If anyone knows someone that's thinking about making a move, now it's never been better for sellers, even with the interest rates going up.
I would think also like that's a good time if like things are going on, family's not sure what to do, not sure if mom and dad are safe, that would be the perfect opportunity to get Kathy in to kind of, do we need support for our loved ones and help them like make that move to a community and what that looks like. Kathy, can you share like when families are calling you like in that moment, like we don't know if they need services or not, like is that an assessment? Is there a cost to that? Is it covered by insurance? Like can you kind of explain how that works for you?
Absolutely. So the first thing I like to do is go meet with people. So somebody calls me and says, my mom or dad, my aunt and uncle, whatever, are living in somewhere in the Lehigh Valley. And, you know, we think that, you know, mom's been falling a little bit. Last time we were to visit, the pill box was still full of pills and we're not sure if they're taking them or going to the doctors or they've lost weight or maybe their hygiene's falling off a little bit. And, you know, but then I get calls around the holidays because everybody gets together and then maybe a few months go by, nobody's really done anything and now they're concerned again. So the first thing I do is go and meet with the people, you know, the family and just have a conversation with them. And you can tell a lot about how somebody's doing in, you know, with the face-to-face. The face-to-face is real important. So even through COVID, I I suited up, I did my PPE and I tried to get it because you have to kind of look somebody in the eye, see where they're living, see their environment to really make a full assessment. But yes, I have a pretty structured assessment that I go through. It covers all aspects of their life. It covers their emotions, their spiritual, their nutritional habits, their environment, you know, their physical abilities, all of that, and then kind of sit down with them and we can zoom in the concerned family members and people who will be helping them make decisions. And I can, you know, give them the information. I never make decisions on behalf of my clients. I give them the information that they need to make their own decisions. And then I help them implement those, whether it's bringing services in or if it's time to, you know, call Shirley and Brian.
I had someone that had mentioned this to me. They didn't understand, Jess, and I want this for you to explain it because a lot of people I think are confused about like when someone needs services, but do they need palliative services or hospice services? And those how different those two things are. Can you kind of explain that to us?
Absolutely. So it's a very common question. We get this a lot. What is hospice? What is palliative? How are they different? How are they the same? So the whole thing is hospice and palliative care both provide pain and symptom relief for people with serious illnesses, chronic disease, but there are some really important differences. So hospice typically does begin in the later stages of the illness when someone is given about a 6-month or less time frame to live. So palliative care, however, can start at any stage of the illness and still be receiving curative treatment. So that is really the difference. The palliative care team will talk with patients and families, making sure everyone really completely understands the disease, the diagnosis, treatment options that are available, and really the choices regarding medical decisions. So it's really a lot of conversation, which is really, really important for people to understand the decisions they're making. So with palliative care, a decision can be made to go with curative treatment. It can go for non-curative treatment and palliative care. But they really want patients and families under palliative care to make an informed decision. So that's kind of where hospice is the response to that. And
I think the
hospice
other,
services, yeah,
Oh,
I'm sorry.
I'm sorry. I was just gonna say, I think also people think that with hospice, you're gonna be there 24 hours a day. I get that all the time, like when someone's gonna go on
Absolutely.
hospice.
Yeah, and hospice really goes where home is. It can be in a personal residence, it can be in a facility. So we go wherever the patient is. Our nurses are available 24/7 by a phone call if concerns and questions arise. However, our staff is not available 24 hours a day to remain at the bedside. So that is one of the main things. We work closely with family members and educate them to empower them to become caregivers and give them the information that they need. If we are working with a family that does want somebody to stay at home, but they need additional help, we will reach out maybe to somebody like Kathy, who might have resources or connections with a private duty agency that we can kind of help each other out and supplement care. So the one thing is though, as a patient does decline, our services do increase. So our plan at the beginning is very patient specific as to their needs. So, we start out, but we will increase as more needs are identified.
Yeah, so there are situations where hospice is discontinued.
Yes, so we've actually had patients graduate from our services with the extra support of our nurses and our nurses' aides and the extra care that they're giving. Sometimes somebody who they used to call it failure to thrive, now it's a protein calorie malnutrition diagnosis, but they do start eating a little bit more. They do start getting a little bit better and they don't meet criteria. So we do have patients that graduate. We also have patients that may decide, you know what, I think I want to go back for aggressive treatment, and they can revoke services at any time and they can go back for aggressive treatment. So it's a great question. Honestly, I think that's one of the things too, people think when they're on hospice, there's no way out, and that's not true. And we're supportive of decisions. We will also try and help the patient and family make a well-informed decision and communicate with their doctors and get information that's necessary for them to make the decision.
Awesome. Donna, I had a question that I saw when I was reading up on some stuff. And I've had this conversation with my family members, and they want us to spread their ashes in different places. So is it illegal to scatter ashes is my question.
Well, that's a very interesting question. The legal response is that you may scatter ashes anywhere that you own or you get permission from the private property owner. If you want to scatter in the ocean, you can scatter outside of 3 nautical miles of the United States coastline. Now, that is the legal explanation for that, but I'm sure you all know that there are many people who have done other things. And the bottom line is that we need to understand that once cremation has taken place, that the ashes are inert. They don't pose any sort of biological hazard. And the real problem with scattering on, say, private property or, at the Penn State Stadium or Disney World is that just because you feel and your family feels it's fine, the next person doesn't. And so basically most of the public places say that you cannot do that. So having said that, I'm sure that of people who did, like I said, and if they're discreet about that, I'm sure that nothing will ever come of it. So yes and no.
Yes and no. I I never thought about that, like how other people would feel. Like, I guess I didn't. I guess I never thought of that because I was just trying to fulfill the wishes that someone would be asking of me. So that's interesting. Let's see, Brian. This one, I can't wait to ask you this question because I know, like, my parents, for instance, think everything in their house has great value. And so, like, I'm always like, that's really not going to be worth selling. But so how does that discussion happen? Like, what do you do with, like you can't take it all with you where you're going, whether it's a community or like, what does that look like for you guys when you're helping families? You're muted.
I see it now. Well, we always have that conversation, and we're usually pretty subtle about it, but we try to go to the popular and the high dollar items first and get them all excited that this was my mom's secretary desk, or this piece is really highly sought after. So it softens the blow when we're working on the 1970s flowered sofa that they think there's some life left. And we can usually find a donation. We can find a home for those things. It's just not something that anybody would buy. So we'll go around and we'll start putting little stickers on things that we're selling. And if there's something that's on the fence and mom or dad are adamant about it, we'll put it up and say, hey, we're going to get you the best price available to the public at this time. So I don't know that it's going to be worth anything, but we'll sell it for you. We'll see. If it doesn't sell, we'll donate it. But we have pretty good success. We try to keep the sale a little more upscale so that it doesn't turn into like a flea market. We tap dance a little bit, but again, we always start with the good things. There's always a handful of things that mom and dad are excited about. We focus on those. I have some surprising items that do really well that I can kind of share with people. So look, I got this and I got that, and kind of get them all excited to see what would happen. And then the nice part about it, the thing that we do the best, we feel, is the online auction. So it's very transparent. Mom and dad and the kids can follow along because it's online, and they can kind of see who is watching it, who's looking at it. And then, the night of the close, it's pretty exciting because things go through the roof. And by the time that happens, everybody's, excited to see what this went for. So we just do a little song and dance, and it seems to work out at the end.
I imagine.
And I have a question for you. Do you assist with moves to other places other than communities for seniors?
We try not to. We try to stay in our lanes, and we work with senior communities. If it's a 55 plus and it's smaller, we will. But we try to work, specifically with communities, so that we don't get too broad. We do moving, but we don't want to be considered a mover. We work with seniors. We get them into the senior communities, and because there's such specific needs that they need to take care of, we try to stay there, because moving a family from a 3-bedroom to a 4-bedroom, that's for other companies to do. We want to stay where we can really specialize and focus on the needs of the senior and helping the family do the transition during what may or may not be a difficult time. So
tell me, how do you counsel families as to what to bring?
Well, I usually, I have a floor plan software. So we go through the house and, we kind of cherry pick and then kind of rank things that they want to bring. And then I draw a map for them on software. We bring the map and we kind of show them that it may not fit. I mean, you don't want a wall full of tables all the way around the house. So we always talk about safety and the ability to move. So, at that point, we try to get the family involved, and it wouldn't be the first time and it won't be the last that we brought too much and then took it back home. I mean, we're not going to argue with mom and dad. It's a stressful enough time. If they want to bring it, all right, we'll bring it.
They might have to visually see that
They have to see that it doesn't fit, and then we turn it around and take it right back. just did one of Traditions of Hanover. He had to have his dining room set that was monstrous, like 6 chairs and a big long oval table. A week later, we're bringing the bistro table in from the basement because I said it's not going to fit. And the team came in from Traditions and they said it's not safe. So here we go, bringing it back, and that's fine. That way, Mom and Dad are happy. They're satisfied. They've already been there for a few days, and it kind of clicks once it's there. We do what they need. It's not a time to argue, or at least me. I mean, if the kids want to argue, and then that happens too, we just kind of step aside. But we're not going to sit there and fight. We try to sell and manage the items as best we can.
Shirley, so do you think with selling a house, do you think they should find their next step first, or how does that look? Like, make things transition as easy as possible?
Yeah, absolutely. Because we know in this fast moving market, they're gonna be under contract in a day. And very often, a lot of these adult communities and assisted living facilities, they're working with us. They're working with the folks that are moving in there. So we have a little bit of time so that we can sell the home and then pay, so to speak, pay the piper after the home is sold. Or we'll use a bridge loan again. And I wanted to mention something because Brian and I do work pretty closely together. And just to kind of chime in on that, decluttering, item selection, however you want to do it. I've started working with my seniors a little bit a more refined way because of some of the experiences that Brian and I have had. There are some folks who just they're just not going to allow you to take their things away. And Brian's, poor guy is stuck there like with all this furniture, all these boxes, all this stuff. So we started trying to work with them in conjunction with Brian. I have somebody who goes in and she's kind of on my team, and then she goes in and she helps them sort through some of their very, very important things. She'll even go through some of the items to get ready for Brian in advance, or anyone else. I mean, I know Brian's not the only one I work with, but predominantly. So I just wanted to share that. It's really nice if we can have I have someone on my team who's really just so soft and gentle and kind to a fault. And she will help go through really important things. First of all, important papers, packing those up so they don't get lost in the shuffle. A lot of times, when we actually lost a drawer. I was like, how did we lose a drawer? Well, because it was on a pile of stuff, and it was a rubbish remover. They just took the stuff and threw it away, but that wasn't anyone's fault. The seller just didn't have it in the right place. Well, now we're helping with those types of things. Like I said, we've refined it a little bit. We'll go through those family photos. If there's a box of them, we've actually helped somebody put them on discs, and we made them for everybody. We made thumb drives for everyone in her family. So, there's lots of ways that we can help move them along when they're, if you will, decluttering. We don't even use that word. We use the word neutralize, as we're neutralizing and downsizing their home. So hopefully, Brian, you're going to see the results of that.
Shirley, to your point, I think all of us, we're part of the reason why we're in the businesses that we're in and we're doing what we're doing as well as we do is because we take the time. We take the time with people. I know myself, I'm a fast talker, and I have to be intentional about slowing down and assessing for understanding. And because, we're working with folks when they're going through transition. And somebody said, sometimes it's a good time and sometimes it's not a good time. And I think it's really important to understand that people need the right amount of time and patience to process the information.
Yeah.
Well, as we're winding down, I thought if each of you wanted to maybe share one more thing that maybe we didn't hit upon that you feel is a golden nugget for the people that are viewing or the people that will view in the future, I'd ask you to do that now. So I'm gonna ask Jess to start us off.
All right. Again, I encourage anybody who has any questions about hospice. We're going to have our email addresses in the chat to please reach out directly, because as I mentioned earlier, I think hospice sometimes is so misunderstood about what it is. And really, it's all about a lot of support. It's emotional support, spiritual and physical support by our staff. That there are many times families will say, I can't believe we didn't get these services sooner. So, you know, one of the things too is everybody thinks cancer is the only diagnosis, and that is not true. There are many diagnoses that do qualify patients for hospice. Some of the other ones, Alzheimer's and other forms of dementia, heart diseases, liver diseases, lung diseases, and there are other conditions, you know, that are kind of end of life. And, you know, if anyone is ever in doubt, sometimes primary care physicians are hesitant to talk about it. So we encourage you to ask your primary care physician if it's a thought that crosses your mind about a loved one. Would they be appropriate? What do you think? So sometimes the initial conversation needs a little kickstart, but again, we are a lot of support, and it's a wonderful service that it's a Medicare benefit. So please reach out at any time with any questions. And we have a nurse, we have a physician on our staff that kind of drives the care as well. And it's really driven by the patient and family. So please keep that in mind.
Thank you, Jess. Kathy?
I guess one thing that I would like to just bring to the forefront is, because somebody decides that they're willing to accept help does not mean that they are giving away all of their control. You know, I just want to make it understood that, you know, I don't go, while I'm capable and qualified to cover all aspects of care management, I tailor my services to the needs of my clients and their families. So a lot of times I think there is this perception that people are giving away their control, and now my kids or the care manager are going to come in and run everything. And that is not the case at all. I work with people on where they need to be helped,
Awesome.
where they
Thank
choose
you.
to be helped.
Thank you. Donna?
So I think the underlying thing with that everyone's been saying is that communication is very important, not only for us as professionals to slow down and start where the family or the person is, but also to encourage children to communicate with their parents, to encourage professionals to reach out, explain the services that are available, and just be available to answer questions whenever it happens to be. And certainly these days, you know that people shop in their underwear at 2 o'clock in the morning, and that's when they want to ask you the questions, because that's when they're thinking about it. And I think we as professionals need to know that we have to check our email and be open to all kinds of communication, not only with the people that we might be servicing, but also family members.
Thank you, Donna. Brian?
Thank you. One thing I'd like to leave those who are listening is we do offer the wide variety of services, from, you know, packing services, moving, resettling, all the way out to selling and cleaning at the house. But we don't have to do all the services. We will do the services that the family needs. So if mom wants the daughters to help her pack, or if the family has used this auctioneer for 20 years, we will fill in the gaps to help the family get through this time. So we don't have to do it all. We do what the family needs to get it done. We don't hire outside companies. Everybody that comes into your house works for me. They're employees, we're licensed and insured. You get to know the guys. I mean, you'll see the same guys in your house 2-3 days in a row. You'll get to know what they do and what, you know, where they've been and all the other things. So it's really a nice relationship. By the time we finish the process, my team is, feels like they're part of the family, and the family feels like, geez, I've seen him, a half a dozen times these last 3-4 weeks, depending on the needs. So, whatever you need, we're here. All consultations are free. So if you have any questions, even if I can't help, I'll point you in a better direction. So we're here to help.
Awesome. Shirley?
I would say, in closing, don't do it alone. I think you've heard that now from pretty much all of us. You definitely don't want to do it alone, especially with real estate agents. I love it because, everybody thinks, especially now in this market, that they can do it without an agent. But particularly with our seniors, there's so many things that really need to be considered. And it's not just, putting the house on the MLS and throwing a sign in your front yard. We want to make sure that we're a point of contact for you, that we're coordinating things for you, that the move that you're making is as seamless, as stress-free and joyful, like Brian had mentioned, as possible. And then the other thing that I really want to share that's so important is these moves take many, many months sometimes, 10 months to a year, if you're planning properly, if you're thinking about it early enough. And what we always hope for, and I've said it with a couple of people here who are on the panel, and certainly other professionals helping our seniors, we really want you to make the move when it's your decision. That is the best case scenario. That way we can help you best, we can take the time we need, and you don't ever have to be afraid that it's going to be a bad market to sell your house, because there's always people looking for homes. And so I would say, please, don't do it alone, and make sure that you're planning ahead if possible, and making the decision when it's your decision to make.
Awesome. I want to take the opportunity to thank all of you for joining us tonight. I also want to invite you all. Our Senior and Caregiver Expo is coming up on June 2nd. So we will have St. Luke's and Lehigh Valley Health Network providing our speakers that we will have that night for the caregiver portion. So 9 to 12 is the Senior Expo, 4 to 7 is the Caregiver Expo. And again, there will be speakers on senior related topics that will be held that evening. So I thank you all for participating and joining us tonight, and I wish you all a wonderful night. Thank you.
Thank you, Kim. Thank you, everybody.
Thank you, everyone.